They say that kidney stone pain may be worse than anything except childbirth, and even that's arguable.
They walk in usually holding their back and in a lot of pain.
To ease or even eliminate that pain, researchers at the University of Washington are working on a new therapy using non-invasive ultrasound propulsion of kidney stones.
Ultrasound has a lot of potential. These space-age things of using some wand to actually do something inside a patient's body may actually come true. We can move stones.
This technology can help in the doctor's office or right in the OR.
Kidney stones are so common in the emergency department. They're responsible for over 1 million visits a year.
In 2013, I had quite a considerable burden of stones.
In the first human subject clinical trial of ultrasound propulsion, doctors succeeded in moving stones in volunteer subjects. The results surpassed expectations.
There was no pain involved.
UW urologist Matthew Sorensen believes not only is ultrasound therapy virtually pain-free and non-invasive, but it is less expensive than CT scans and does not expose patients to radiation.
We had the opportunity to try several different things with the trial, and I think in the beginning we really focused on small stones, trying to encourage them to pass. From all the work that we had done in the lab, we knew we were going to be successful at moving stones around.
Sorensen sees progress on 3 main challenges.
One of the big efforts is detection and sizing, pushing stones, and also breaking stones. If it works like we hope it will, it could replace the majority of the stone treatments that we do. The pushing stones there's nothing like it. It's a potentially transformative technology for kidney stones. Even if we could make stones pass while they're small, before they are of a size where they need surgery, they would potentially save patients some surgeries. Averting an emergency would be really valuable. And then the third technology and the third thing that we're working on is also another potential game changer, and that is breaking stones.
Trial subject Craig Mundy.
Basically, I've had 2 bouts with stones about 2 years apart.
Craig Mundy is a patient of UW urologist Dr. Jonathan Harper.
In your case, we found a couple of things. We were able to, what appeared to be, move a stone out of the kidney into the ureter. And then we also found another stone that we think we may have dislodged from its anchor. A lot of the stones will grow attached to the inside of the kidney. And if we can detach those and so on when they're very small, hopefully they can pass uneventfully.
It is definitely the case that, if you can take them when they're little and find them through these totally non-invasive screening methods, then it clearly would be better to knock them loose and let them go out than to have to endure any of these things.
Yeah, there certainly is a size where people could pass stones without much pain or even feeling them at all. Did you have pain during the procedure?
No, there's almost no sensation at all. The only thing I recall was sort of just a warming sensation.
So is your experience such that you would have this done again if it looked like it could help you?
Absolutely.
Our goal is to be innovative in everything we do: patient care, research, education. And one of the ways we do it is just by putting things together that don't normally belong and finding ways to bridge them. Engineers and urologists is one example. And I'm most excited about this idea that we could take a patient in the emergency department who might need a surgical intervention tonight at 3 a.m. and then another one a few days later to treat the stone. Could we use the ultrasound to make one of those procedures unnecessary? That's the really exciting thing.
Ultrasonic propulsion changes the game. It gives us the opportunity to reposition a stone, relieve the obstruction, and potentially make somebody feel no pain, go home and enjoy their life, their weekend.
The urologists have said, this is what we want, this is how we'd like it to look and work, and we've moved as quickly as we can to establish its safety and effectiveness, and we want to continue to work with FDA to get this out there so the urologists can really see how this works, how well it fits into their practice, where exactly they want to use it.
Science at work for you. This is APL, the Applied Physics Laboratory at the University of Washington in Seattle.